To apply t-test, sample should be random, values should be normally distributed, sample size must be less than 30, uh, false answer data should be categorical, can be applied to before and after a study. A manifest variable includes true answer IQ knowledge, false answer intelligence, skill, efficiency. Comparative study design includes true answer case control study, cohort study, false answer longitudinal study, case series study, RCT. লংগিটিউডিনাল স্টাডি আর কোহোর্ট স্টাডি একই, এটা ট্রু হওয়ার কথা. Factors to be considered for selecting a research topic are true answer feasibility, applicability, false answer equity, redundancy, authenticity. Hierarchy of hazard control in workplace includes elimination of risk, engineering control, substitution, false answer risk assessment, replacement. Natural sources of cholecalciferol are true answer animal fats, exposure to UV rays of sunlight, fish liver oils. False answer green leafy vegetables, olive oil. Features of marasmus comprise true answer loss of subcutaneous fat, obvious muscle wasting, false answer edema, poor appetite, presence of skin changes. Intermediate risk factors of NCD include true answer low physical activity, obesity, false answer hypertension, hyperglycemia. Vehicle-borne diseases are true answer Chagas disease, brucellosis, malaria, false answer encephalitis, schistosomiasis. Chalk and talk are done by true answer flip chart, exhibits, flannel graph, false answer poster, internet. Components of a process-based planning model include true answer input, output, outcome, budgeting, monitoring. Universal health coverage concerns with true answer full range quality services, out of pocket expenditure, false answer need minimal skill mix, human resource, adjusting with MDGs. Health inequality as a challenge. International classification of disease is used worldwide for true answer detecting morbidity, statistics, false answer decision making, operating reimbursing system, disease burden reduction, disease surveillance. International health trade deals with true answer trade liberalization, false answer context of health, international health, health governance, health policy. Latent period is true answer length of time of shedding agent, shorter than the incubation period, longer than the incubation period. False answer gap between primary and secondary cases, length of time of invasion by an agent. Structural proteins of dengue virus are true answer membrane protein, envelope protein, false answer surface protein, ribosomal protein, spike protein. Macroeconomics deals with true answer health policy, health system, false answer tertiary hospital, community resources, patient satisfaction. A public good is true answer universal, false answer excludable, rivalry, inequitable, inclusive. Moral hazard is a hazard with true answer third party insurance policy, policy holder, healthcare provider. False answer, payment system. Stages of health education are true answer stage of sensitization, stage of publicity, stage of transformation. False answer stage of adoption, stage of appreciation. Merits of mass media communication are true answer gets public attention, reaches wider population, more effective for illiterates, less expensive. False answer supports periodic program. Outcome of an analytical cross-sectional study can be measured by true answer prevalence ratio, odds ratio. False answer incidence ratio, risk difference. In a RCT control group may be given true answer placebo, false answer an existing drug, one drug with another, new therapy, similar therapy. Social geriatrics deals with the true answer clinical care of elderly people, promoting geriatric health. Clinical care of elderly people promoting geriatric health, psychological study of elderly people. False answer disabilities with old people, ethical issues of old people. Outcome of a cost benefit analysis will be true answer সবই false, quantitative, monetary, equivalent, intangible, variable. New about SDG includes universality, transformation, equity. False answer integrity, dignity. Non-parametric tests in statistics include true answer McNemar's test, sign test, Mann-Whitney U test. False answer ANOVA paired eye test. Community treatment techniques are true answer community counseling, community surveillance. False answer community based survey, community action research, community registration. System software includes operating system software, utility programs. False answer library program, SPSS application, STATA. Medical legal issues related to aging are true answer elder abuse, euthanasia. False answer power of attorney, autonomy, geriatric essentials. Scientific misconducts are paraphrasing, coating, fabrication. False answer cooking, forging. Community core comprises demography, economic status. False answer air quality, safe water supply, food availability. International network of RUD deals with the true answer research on drug, training on drug, bibliographies on drug. False answer drug supply, drug monitoring. Arsenic exposure leads to white food disease, black food disease, cellular energy starvation. False answer black water fever, pancytopenia. Universal health coverage concerns with full range quality services, out of pocket expenditure. False answer need minimal skill mix, human resource adjusting with MDG. Health inequality as a challenge. Perishable food item includes true answer meat, dietary product, fruits. False answer pulses, vegetables. Pregnant women require extra provision of energy for development of fetus, placental development, psychological well-being of mother. False answer, deposition of body fat, bony growth in mother. Vitamin stored in the liver are, all answer are false. Vitamin A, vitamin B1, vitamin 12, vitamin K, vitamin C. National components beneficial for mental health are, true answer omega-3 fatty acid, vitamin B6, vitamin B12. False answer, saturated fat, simple sugar. The standard deviation is, true answer, an indicator of how numbers vary from the mean, the square root of the variance. False answer, a measure of location, the middle value in the list of numbers, very sensitive to extreme values. Direct healthcare cost includes, true answer, travel cost, consultation cost. False answer, family cost, loss of income, attendant cost. Features of suitable campaign are, create public awareness, one of the methods of communication used in mass scale, used mostly in health communication. False answer, used in individual learning. Disease under active surveillance of EPI are, acute flaccid paralysis, congenital rubella syndrome, measles. False answer, diphtheria, tuberculosis under 5 children. Disease under active surveillance, acute flaccid paralysis, maternal and neonatal tetanus, measles, rubella, congenital rubella syndrome. Essential newborn care ENC includes exclusive breastfeeding, thermal care, vaccination. False answer, umbilical cord care, vitamin A supplement. Chemicals present in tobacco include benzene, cadmium, chromium, formaldehyde. False answer, toluene. Dependable source of zinc are fish, meat, milk. False answer, cabbage, spinach. Leading causes of death in low birth weight babies are, malformation, intracranial bleeding, pneumonia. False answer, malnutrition, diarrhea. Objectives of postnatal care are to prevent complication of postnatal period, provide family planning services, check adequacy of breastfeeding. False answer, immunize neonate, reduce maternal depression. The target protein for drug binding include enzyme receptor ion channel drug. False answer, muscle. Professional negligence include, true answer, criminal malpractice, civil malpractice. False answer, battery, breach of contract, assault. Scopes of hospital good governance are, efficient use of resources, consensus oriented, maintenance, transparency. False answer, risk management, safety. Plan formulation consists of, true answer, objective, program, schedule, budget. False answer, target. Major strategies for implementation of population policy are, true answer, behavior change, communication, elderly welfare program, adolescent welfare program. False answer, ensure 8-hour services at Union Health Center, ensure regular supply of required medicine and equipments. Diabetes transmitted by droplet infection are, disease transmitted by droplet infection are, COVID-19, diphtheria, tuberculosis. False answer, rubella, varicella. Diseases that have been declared eradicated by WHO are, smallpox, rinderpest. False answer, cholera, poliomyelitis, yaws. Incubatory carrier state is found in, true answer, mumps, measles. False answer, amoebiasis, cholera, whooping cough. Incubatory carrier, measles, mumps, polio, pertussis, influenza, diphtheria, hepatitis B virus. The hazardous effects of dust on pulmonary tissue depend on, true answer, fineness of the dust particle, duration of exposure. False answer, biological consumption, concentration of dust in air, susceptibility. Features of vitamin E include, true answer, an important antioxidant, affect DNA synthesis. False answer, normally found in leafy vegetables synthesized by bacteria in colon, a cofactor in the production of gamma carboxyl glutamate. Vaccines can be administered during pregnancy are true answer live influenza vaccine, tetanus toxoid, false answer hepatitis B vaccine, rabies vaccine, varicella vaccine. In virus transmitted through placenta are true answer herpes simplex virus 2, rubella virus, false answer hepatitis C virus, human papilloma virus, Zika virus. Active passive immunity occurs in true answer hepatitis B, rabies, tetanus, false answer measles, varicella. Emerging zoonotic diseases in Bangladesh are true answer Nipah, pandemic H1111, false answer Ebola, Crimean Congo, hemorrhagic fever, Middle East respiratory syndrome, coronavirus. Middle East respiratory syndrome, coronavirus. Physiological factors affecting communication are ability of hearing, ability of seeing, false answer attitude, interest, mental condition. Group approaches of health communication are role play, seminar, workshop, false answer radio, television. Factors related to increase in population size are birth, immigration, false answer death, emigration, male marriage in patriarchal society, male marriage in patriarchal society, male marriage in patriarchal society. Parameters used in growth chart are age in months, mid upper arm circumference, height in centimeter, weight in kg, false answer age at birth. Recent traits in maternal and child health care includes integration of care, manpower changes, primary health care, false answer EOC, organization of MCH services. New concept in MCH include integration of care, risk approach, manpower changes, primary health care. Feature of monitoring include true answer feedback is vital, measures performance, false answer distinct process by itself to improve program undertaken periodically. Population statistics include dependency ratio, sex ratio, false answer birth rate, death rate, natural growth rate.